afternoon, students. Today we can learn about the arterial supply of heart. Okay, heart. So the arterial supply of heart is the coronary circulation. So we can first see the arterial supply, that is arteries which supplies the heart. Okay. The arteries which are supplying the heart are known as coronary arteries, and there are right and left coronary arteries. Both are the branches of ascending aorta. We already studied the coronary arteries are the examples for physiologic functional end arteries. So functional end arteries, that means even though there is anastomosis between the branches of coronary arteries, and the anastomosis is not effective or not compensate with the other arteries, cannot compensate with the other for each other. Okay, that's why it is known as functional end arteries, and we'll see in detail. So there are two coronary arteries. One is right coronary artery and another is left coronary arteries. Okay, so both coronary arteries, both are the branches of the aorta. Okay, in this picture we can make out. So this is the aorta, and here we can see this is our right atrium with the right auricle. This is superior vena cava, aorta. This is infundibulum, that is pulmonary trunk, starting point of the pulmonary trunk, and here comes the right ventricle. This is the left ventricle, and posteriorly this is our left atrium. Okay, we can see the pulmonary vessels there. This is the cut end of the left auricle. So here you can see this is the aorta, ascending aorta, which is starting from the left ventricle. You can see like this. So it starts from the left ventricle, and at the starting point of the left ventricle we can see three bulgings at the starting point of the aorta. Okay. So they are known as sinuses. So three sinuses can be seen at the starting point, and they are known as sinuses. So among these sinuses there is one anterior aortic sinus and two posterior aortic sinuses. Okay. And the right coronary artery starts from the anterior aortic sinus. So this is the picture of starting point of the aorta. So this is our aorta. Here we can see the semilunar valves of the aorta. So above the semilunar valves there will be bulging. So here interior there will be depression. So outside we can see the bulgings. So these are known as sinuses. So this is the aortic sinuses. Okay. So there is an anterior aortic sinus and two posterior aortic sinus. Posterior aortic sinus will be one left posterior and right posterior aortic sinuses. Okay. So these are the sinuses. So our coronary arteries, we can see the openings of the coronary arteries. So this is the starting point or the origin of the coronary arteries. So we can see this opening. So this is the starting point of right coronary artery. Here we can see this is the left coronary artery opening. Okay, so that is the aorta and its aortic sinuses. So our right coronary artery starts from the anterior aortic sinus, then it passes between the right auricle. This is our right auricle. So it passes between the right auricle and the pulmonary trunk. Okay, it passes anteriorly and to the left, towards right. Okay. So between the auricle and right auricle and the pulmonary trunk. Okay. Then it passes down, descends downwards through the anterior right atrioventricular sulcus. That is anterior coronary sulcus. Okay. Right coronary sulcus. So passes between the right atrium and the right ventricle. It passes downward and it reaches the inferior border of the heart. So it reaches the inferior border, then it winds round the inferior border. It winds round the inferior border and reaches the diaphragmatic surface. So this picture we can make out. Then after winding round the inferior border, it reaches the diaphragmatic surface. This is diaphragmatic surface, and it passes through again right coronary sulcus, that is between the right atrium and the right ventricle. And it passes backward and towards the left. Passes backward and towards the left. And when it reaches near the posterior interventricular sulcus, this is posterior interventricular sulcus, it ends by anastomosis with the circumflex branch of the left coronary artery. Circumflex branch of the left coronary artery. So it ends by anastomosis with the left coronary artery. Yep. So that's the course of the right coronary artery. Then we can see which are the branches of the right coronary arteries. First, it gives a nodal artery that supplies the SA node. A nodal artery. This is nodal branch, we can see. It's going to supply the SA node. This is nodal branch. Then there will be atrial branches. It supplies the right atrium. Atrial branches arises from the right coronary artery, supplies the right atrium. There will be ventricular branches which supplies the right ventricle, and towards the inferior border you can see one large branch, that is the right marginal artery. This is the right marginal artery. It supplies the inferior border of the heart till the apex. It reaches near to the apex. So this is right marginal artery. Right marginal artery. Then towards the posterior aspect, in one more branch, it gives one cornus branch. This is the cornus branch which supplies the cornus starting point of our pulmonary trunk. So this part supplies the it gives branch that is known as cornus branch. Cornus artery, right cornus artery. So this right cornus artery will be anastomosis with a similar branch of the left coronary artery, that is left cornus artery forms a circle around the starting point of the pulmonary trunk, that is known as annulus of Wissens. Annulus of Wissens. Then gives a nodal branch for the SA node, then the atrial branches, then ventricular branches, then right marginal artery, then inferior posteriorly the diaphragmatic surface. It again here also it gives the ventricular branches, and when it reaches the interventricular sulcus, it reaches near the posterior interventricular sulcus, it gives another main branch, that is the posterior interventricular artery. Posterior interventricular artery. Okay. And it ends by anastomosis with the left coronary artery. Okay. So these are the branches of the right coronary artery. Okay, branches. First one is nodal artery, that is for SA node. Then right cornus artery for the base starting part of the pulmonary trunk. Then atrial branches which supplies the right atrium. Then ventricular branches which supplies the right ventricle. Then gives one right marginal branch which supplies the lower border of the heart. Then posteriorly, when it reaches the diaphragmatic surface, this is our right marginal artery, and when it reaches the posterior surface, it again gives ventricular branches and also atrial branches, and when it reaches the interventricular sulcus, it gives a posterior interventricular branch, that is one of the main branch, posterior interventricular artery. Then ends by anastomosis with, again it gives branches for the ventricles. Then ends by anastomosis with the left coronary artery. And this right coronary artery, area of distribution, it supplies the right atrium, then it supplies both ventricles, both the right ventricle and left ventricle. Then the interventricular septum, posterior part of the it supplies the posterior part of the interventricular septum, that is through the posterior interventricular artery. It supplies the posterior aspect of interventricular septum. Then it supplies almost all the conducting system except left branch of the AV bundle. So except left branch of AV bundle, all the other conducting part it is supplied by the right coronary arteries. Okay. Then so that's about the right coronary artery. The next is left coronary arteries. So this is the left coronary artery. Here we can see. So it is also a branch from the ascending aorta, and it starts from the posterior left aortic sinus. It starts from the posterior left aortic sinus. Then it first runs forward and to the left. It runs forward and to the left between the pulmonary trunk and the left auricle. Between left auricle and the pulmonary trunk. Here it gives an anterior, then it passes forward and it gives an anterior interventricular branch. That is one large branch. Then it gives one anterior interventricular branch which runs downwards through the interventricular sulcus, anterior interventricular sulcus. And further continuation of the left coronary artery is known as circumflex artery. So hereafter we will call the left coronary artery as circumflex artery. Okay. Then after giving the anterior interventricular branch, the artery runs towards the left, in the left anterior coronary sulcus. Left anterior coronary sulcus. Coronary sulcus means between the atrium and the ventricle, atrioventricular sulcus. Okay. So it passes through the left coronary sulcus and it winds around the left border of the heart. It winds around the left border of the heart and reaches the posterior aspect. In the posterior aspect we can see this one. In the posterior aspect it lies in the posterior left coronary sulcus. Then near the posterior interventricular groove. Near the posterior interventricular groove, it ends by anastomosis with the right coronary artery. It ends by anastomosis with the right coronary artery. Okay. So that is the course of the left coronary artery. Then we can see the branches of the left coronary artery. So the first branch is our anterior interventricular artery, which is one of the largest branch. So this is the anterior interventricular artery. So this anterior interventricular artery again gives ventricular branches. So among the ventricular branch we can see one ventricular branch is large one. This is known as a left diagonal artery. This is the left diagonal artery. Then it gives left conus artery, which anastomosis with the right conus artery. It supplies the pulmonary trunk, starting point of the pulmonary trunk, and this is the diagonal artery. And here we can see small branches which supplies the interventricular septum, anterior part of the interventricular septum. Okay. So that is the anterior interventricular artery. Okay. Then the circumflex branch. The circumflex artery will give rise to left marginal artery, then this is the left marginal artery. In this way we can see. So this is the left marginal artery, one large branch. Then it gives rise to anterior and posterior ventricular branches. We can see here we can make out the small branches, ventricular branches. Then posteriorly also it gives rise to ventricular branches. Then gives atrial branches which are anterior, posterior and lateral groups. Atrial branches which supplies the left atrium. This is our left atrium. So it gives atrial branches which supplies the left atrium. So these are the branches of the left coronary artery. That is anterior interventricular artery, then left marginal artery, then ventricular branches, then left marginal artery, ventricular branches, then atrial branches. And area of distribution, it supplies almost all parts of our left atrium, and it supplies the ventricles. Then it supplies greater part of the left ventricle, then a small part of the right ventricle in the anterior interventricular part. This one, small part of the right ventricle, then part of the left branch of AV bundle in the conducting system. So these are the areas of distribution of the left coronary artery. Then cardiac dominance. So cardiac dominance is the depends upon the which artery will give rise to the posterior interventricular branch. Normally in about 90% of the people, the posterior endoventricular branch arises from the right coronary artery. So it's a branch of the right coronary artery. So we will call it as a right dominance. Then in 10% of people, the posterior endoventricular artery arises from the left coronary artery. Okay. In their case, it will be left dominant. Okay. That is the cardiac dominance depends upon the artery in which give rise to posterior endoventricular branch. Okay. The arteries which depends upon which artery is giving the posterior endoventricular branch. Okay. So that is the cardiac dominance. So if it is arising from the right coronary artery, it is right dominant. If it is arising from the left coronary artery, it is the left dominance. Okay. Then collateral circulation. So we already seen the two coronary arteries will anastomose with each other in the myocardium. So there will be a small anastomosis between the right and left coronary arteries, and but it is functional end arteries, because if there is the part which is supplied by one artery cannot be compensated by the other arteries. Okay, so it is known as functional end arteries. Then there, if applied aspect, if there is any thrombosis of the coronary arteries is common, which causes sudden death in persons of the middle age also. This is due to myocardial ischemia, infarction and ventricular fibrillation. Okay. The incomplete obstruction due to the spasm of coronary arteries causes angina pectoris. So angina pectoris means an agonizing pain in the pericardial region. Okay. That is known as angina pectoris, and this pain will be radiates towards the left arm also, left arm. Then this is the picture. Here we can see this is coronary eye. If there is any block in the coronary arteries, so by doing the angiogram, by taking the angiogram, we can make out if there is any block is there in the coronary arteries, in any branches in the coronary arteries of the coronary arteries. So it causes occlusion of the coronary arteries. So in that case, we will remove the clot and we will put a stent like this. It passes through the artery, and this to make the lumen patent. Lumen of the coronary arteries or branches of the coronary artery, lumen become patent in that case. So this is the, and another procedure is if there is any block, we can put grafting which put beyond the site of blockage. So if there is block in this portion, you can put a graft like this which crosses the blockage portion, and with this from blood from this artery will passes through the coronary another branches, and it supplies the other parts of the heart. Okay. So these are the applied aspects of the coronary arteries. And next is the venous supply of a heart, that is veins of the heart, venous drainage of the heart. Okay. So there will be the venous drainage of the heart is by great cardiac vein, middle cardiac vein, a right marginal vein, posterior vein of left ventricle, then oblique vein of the left atrium, then anterior cardiac vein, and there are small veins which drains the walls of the heart, that is known as venae caudes minime. Okay. So these are the veins which drains the heart, and almost all the veins except the venae caudes minime and anterior cardiac veins will drains into a large sinus, that is known as coronary sinus, and this coronary sinus will opens into the right atrium. The anterior cardiac vein and the veins and the venae caudes minime, they are directly opens into the right atrium. Okay, they directly opens into the right atrium. So this is the coronary sinus. Here we can see this is the coronary sinus, which is one considered as the largest vein of the heart. Okay. So it is seen in the posterior coronary sulcus, the posterior coronary sulcus. So this is the coronary sinus. So we can see the veins which drains into the coronary sinus. So we will see one by one this. So this is the great cardiac vein. So this great cardiac vein, this accompanies the anterior interventricular artery. It is seen along with the anterior interventricular artery. So it first accompanies the anterior interventricular artery. This is the anterior interventricular artery. So it accompanies great cardiac vein. First accompanies the anterior interventricular artery. Then it accompanies the circumflex branch of the left coronary artery, when rounds the left border and reaches the posterior aspect, where it is drains into the coronary sinus. This is coronary sinus. So it drains into the left end of the coronary sinus. So this is the great cardiac vein. Then next is the middle cardiac vein, which accompanies the posterior interventricular artery. This is the middle cardiac vein. It accompanies the posterior interventricular artery, then and it joins the middle part of the coronary sinus. So middle cardiac vein joins into the coronary sinus. Then small cardiac veins. This is a small cardiac vein. Small cardiac vein accompanies the right coronary artery. This is the right coronary artery. So it accompanies the right coronary artery in the posterior coronary sulcus and joins with the right end of the coronary sinus. This is the coronary sinus. So this is the small cardiac vein. Here we can see. So it accompanies the posterior part of the right coronary artery. Okay, that is the small cardiac vein. Then the right marginal vein is there. So the right marginal vein also drains into the this is the marginal artery. So along with the marginal artery, we can see there is a vein, that is right marginal vein. So this right marginal vein, it drains into the small cardiac vein. Here, drains in the small cardiac vein, and the small cardiac vein will drains into the right end of the coronary sinus. Then next is posterior vein of the left ventricle. Posterior vein of the left ventricle. This one. This is the posterior vein of the left ventricle. So it drains the diaphragmatic surface of the left ventricle and ends into the coronary sinus. So this large vein, it is known as posterior vein of left ventricle. And there is another vein, that is the oblique vein. Here we can see. This is oblique vein of the left atrium of Marshall. Left atrium, oblique vein of Marshall. This one. It drains the left atrium. It runs in the posterior surface of the left atrium and terminates into the left end of the coronary artery. Here it terminates into the left end of the coronary artery. And this is, it develops from the left common cardinal vein or duct of Cuvier. Then next is right marginal vein, which accompanies the marginal branch of right coronary artery. You want to see the right marginal vein, which drains into this is the right marginal vein, which drains into the small cardiac vein. So sometimes it will be directly opens into the right atrium also. Okay. And these are the anterior cardiac veins. Anterior cardiac veins, they are the 2 or 3 small veins which runs parallel to each other, and it drains the anterior wall of the right. It can be seen on the anterior wall of the right ventricle and usually opens directly into the right atrium. These are the right anterior cardiac veins, opens directly into the right atrium. Okay. And vena cordis minime, the venous cordis minime or the Thebetian veins, they are the small veins, cardiac veins, smallest cardiac veins, and they are the numerous veins it's present in the of all four chambers of the heart. It is in the all four chambers of the heart. It drains the cardiac wall, heart wall. It drains the heart wall and opens into the all, directly opens into the all chambers of the heart. They are known as venae caudes minime or the Bayesian veins. The Bayesian veins. Okay. Then, so that's about the coronary. We will learn coronary sinus in detail. So coronary sinus, it is the largest vein of the heart. Here we can see this is our coronary sinus. It's the largest vein of the heart. It is situated in the left posterior coronary sulcus. It's situated in the left posterior coronary sulcus. It is about 3 centimeter long. It is about 3 centimeter long and opens and ends by opening into the posterior wall of the right atrium. It opens and ends by opens into the right atrium. And it has the tributaries. We all seen these tributaries of the coronary sinus. First is the great cardiac vein, then middle cardiac vein, then small cardiac vein, then posterior vein of ventricle, then oblique vein of Marshall, then small cardiac vein, then right marginal vein. So all these are the tributaries of the coronary sinus. The tributaries of coronary sinus. So this is the coronary sinus. Then coming to the lymphatic drainage of the heart. The heart lymphatics from the heart drains by the brachiocephalic lymph nodes and also into the left tracheobronchial lymph nodes. Towards the right side it drains into the brachiocephalic nodes and the left side it drains into the tracheobronchial lymph nodes. Okay. Then nerve supply of the heart. Coming to the nerve supply, it is supplied by sympathetic and parasympathetic nerves. Then parasympathetic nerves reaches through vagus, parasympathetic through vagus, and they are cardio-inhibitory because on stimulation of the vagus it slows down the heartbeat. The parasympathetic nerves derived from the upper 4 to 5 thoracic segments, and these are cardio-acceleratory. That is, on stimulation of the parasympathetic nerves it causes increase of the heart rate, and it also dilates the coronary arteries. And the sympathetic and parasympathetic nerves will form plexus, that is superficial and deep cardiac plexus. Then clinical anatomy we already discussed. So that's all about the blood supply, nerve supply and lymphatic drainage of the heart. Okay, and coronary circulation. So the circulation within the heart, that is known as coronary circulation, mainly by the arterial circulation by the right and left coronary artery, then venous drainage. Okay, so that is the coronary circulation between the right and left coronary arteries.